We've been learning quite a lot today about that, about what we can learn from the humanities. One way is that the humanities hold up a mirror to practice, good practice, bad practice, practice that makes people think about the health of the practitioner, practice that actually takes no notice of the patient as a person. So holding up a mirror, but also I think that medical humanities is a way to tell a story to a wide audience, and sometimes even to change something for the better. So for example, today we've got the author of The House of God, Samuel Shem, also known as Professor Stephen Bergman, and his book has been colossally influential to a number of healthcare practitioners in various disciplines, in various countries, in various languages. In fact, it's changed some of the medical language. And it's allowed doctors to come together as a community to actually feel more together, more connected and more resilient. And actually those doctors then are less likely to break down. Those doctors then are more likely, one hopes, to provide compassionate care. So I'm involved with medical humanities through the Oxford Research Centre for the Humanities. I do work with Professor Joshua Horden, and together we've set up, led by Joshua, the Healthcare Values Partnership, which is actually fostering research into this area. We've also collaborated on some specific projects. The first was looking at compassion in healthcare, aiming to increase the public good. The second was looking at a troubled concept of markets in medicine. And now this visit by the author Samuel Shem is part of an entire range of humanities events across the United Kingdom. So today we're going to be talking about values and narratives. So bringing people from multiple academic disciplines to actually shine a light on what stories mean in healthcare. And we're going to be revisiting that at other events with other institutions in Glasgow in a couple of days' time, and at the Royal Society of Medicine on the 5th of October. The writer, the often quoted writer C.P. Snow, who wrote a book called The Two Cultures, about how scientists and the arts don't talk. And in that book he says that literary scholars, though they may not influence policy directly, produce the thoughts that seep into the minds of policymakers. Well, I hope that we can do a little bit more than seeping into the minds of policymakers. So whether it's by holding up a mirror to practice and policy, whether it's actually showing the human face of both policy and practice and seeing what works, what doesn't work, and actually giving real, honest accounts that can, whether it's through the medium of art, whether it's through the medium of theatre, whether it's through the medium of a popular novel, that people can access and think about, and actually can be the focus of a discussion. And that discussion brings people together and allows people to resist injustice. The key message I take away is one that I think is going to be repeated many times today, and that is the risk of isolation and the power of good connection. And that's the key point that Professor Bergman talks about in his books. We're going to hear about it again and again and again, and it is one of the problems with healthcare in terms of time pressures, in terms of pressures to do many things at once, is that stress and that fear can become very isolating. And if we can find a way of raising that in the public consciousness and actually do something about it, then we've done more than we set out to do today.